exciting new option and add-on tonight. We are going to be meeting with Mary Wong, a traditional Chinese medicine specialist in Toronto, and we're going to be interviewing her about her assistance with fertility journeys, acupuncture, traditional Chinese medicine, and talking about how that fits into what we do to help patients along. I am a believer in traditional Chinese medicine for a very personal reason. A member of my family used it, and it really helped when nothing else could. 3 other specialists that we used didn't work out, but finally a local traditional Chinese medicine specialist was able to help this individual. So we became believers really after that. And so I'm very excited to have Mary on the show. We're going to give everybody a minute to jump on board. And once they are here, we will chat about what we've got in store for you. So grab your tea, grab your coffee, and we'll go from there. Hopefully you've all had a good week and everyone is doing well. I am post-call, so I was up all night delivering babies. And so if I have to keep clearing my throat, it's because I have no voice left at this hour. But I've got some good green tea next to me here, and we will hopefully have a good show for you. So I met Mary because Mary reached out to me online. And Mary works in Toronto, where she is part of a group with, I believe, multiple clinics, but we're going to have her jump on now and join us. So Mary, welcome to the show. I know you have been waiting patiently for us to get going, and we are very excited and very honored to have you join us. And hopefully you can tell all of our viewers a little bit about yourself and about what you do.
Thank you for having me. I'm so super honored to be here. And so I am a traditional Chinese medicine practitioner. I've been practicing for, 28 years, so a little while now. And I came by fertility, honestly, because I actually had fertility challenges myself. And so just to give you a little preview, I had blocked fallopian tubes. We had been trying starting at the age of 38. I met my husband later on in life, and we wanted to get going right away. And as we were trying, it wasn't happening. And of course, my thought, in the Western scientific world, it's like, it must be because you have aging eggs, right? But for me, I was like, both my grandmothers had babies naturally at the age of 46. So surely it can't be me. It must be my Belgian drinking husband, must be, right? With his aperitif and then the wine with dinner, right? And but unfortunately for me, he actually had stellar sperm. And so the issue was with me, and we didn't find out that I had blocked fallopian tubes, and it's called hydrosalpinx. So it's not only blocked, but it was also fluid filled. So there's 2 issues. One is, egg and sperm cannot meet. And then even if they did by random chance, the thought is that the fluid within the tubes could also be noxious for implantation. So I had 2 challenges. So in the end, I surrendered to Western medicine. And to preface that, all along growing up, I had always been a big fan and wanted to be in medicine. But when my grandmother got sick, and she was given 2 weeks to live, and she was 86 at the time. And so we said, okay, fine, we'll take her home. And when we did that, we thought, okay, well, why don't we try Chinese medicine? We hadn't tried that before. And we did. And she lived another 8 years. I was in second year university at the time. So I was, pre-med in that line, in that train of thought. But when that happened, I thought, holy cow, that's a big gap that needs to be filled. So I just finished my degree, and I actually went straight into Chinese medicine school, and I never looked back.
That's amazing. Where did you do your training?
So Chinese medicine, I actually did it in BC, British Columbia. It was the first college in Canada, really, that was a full-time program. And I had the option of going to China, but ultimately I didn't. And the biggest reason why, I thought, gosh, people are different in the West, so they may not appreciate how it's done. Certainly and I've seen it, I've experienced it, right? So Chinese medicine practitioners sometimes that practice in the West will do unto you what they think should be done unto you. And I practice what I call interactive acupuncture. So I
Okay.
actually listen to the patient and then I'll assess and I'll do it based on their tolerance. So for example, some people when they do acupuncture, they're what I call needle shy.
Right.
And so I'm not going to do aggressive or assertive style needling or what we call da chi, which is grasping the energy. I don't know if you had acupuncture, Dr. Victory?
I have never had acupuncture, but I'm just about to because my shoulder has begun to really bother me lately. So I'm going to actually try that as my first line of therapy.
Absolutely. That's
Yeah.
great.
Yeah.
So, at that time when I witnessed my grandmother get well, I was with a triathlete. And back in the
Oh,
day,
wow.
nobody was doing triathlons. So anytime he would get an injury, I would witness him getting acupuncture and bam, like within a week, he would be out back running and swimming and cycling. So
Amazing.
it works really well. And when people look at acupuncture in the past, pain is the number one treatment that it will help, right? That
Yeah.
people know of in the West, right?
Right.
But now in the past 8 years, if you look at, if you go to scholarly Google and you just type in acupuncture, there's over 12,000 researches done for acupuncture specifically. And then what
Wow.
was really interesting in the past 8 years, there's much more interest in the realm of fertility. So I think that's fascinating, like acupuncture and fertility.
Yeah. So tell me a little bit about how you got into the acupuncture and infertility part. Was it just from patient demand, or did you find that that was like an area that really needed to be addressed?
So it kind of fell into it, my personal interest because as an entrepreneurial woman, I delayed my um, delayed marriage. And so all in the back of my head, I always was interested in fertility preservation naturally, right?
Sure.
And then in the end, so people just started seeking me out. Like I started seeing it, but then of course, when you have good results, people just start hearing about you. Like today, this woman says, "Do you know you have a cult following?" And I'm like, "I don't even know what you're talking about." But
So when do you start acupuncture in a fertility journey?
that's a really great question, Dr. Victory, because we often get people coming in like, I've tried everything, I've done everything, I've done like
Yeah.
3 rounds of IVF and it's not happening. So I'm turning to you as my last resort. So some people start there. Some people start literally in the end of their IVF cycle and they're doing the frozen embryo transfer and they've heard about the pre and post transfer acupuncture session. That has become
Right.
kind of famous. That's what
Right.
people look to. And if I may be honest about it, it's like, yeah, it might be a little helpful, but honestly, it may be better if you start before, right?
Okay.
Because if you're looking at the pre and post embryo transfer piece, we're looking strictly at receptivity of the uterine lining. So how can we help implantation, basically? And, you know, Rome wasn't built in a day. Neither has been your uterine lining or you in itself. So it's like, yes, it may help, but wouldn't it be better if we start earlier? And there are some researches that has shown that, if you do acupuncture, even for the frozen embryo transfer piece, like 8 sessions before, and then do a pre and post embryo transfer, there's a higher incidence of success. Now, bring it back even further when we're looking at doing an IVF retrieval. So,
Right.
when you take the eggs out, when they looked at live birth rates for women that, and this is a retrospective study, and there's multiple ones. I'm just referring to the first one that was done back in 2015. So
Mhm.
Lee Hollander Rubin went to look at women. There were over close to 4,000 women and looking at live birth rates for those who did what she calls whole system TCM, meaning traditional Chinese medicine, which
Right.
includes acupuncture, Chinese medicine, lifestyle, dietary changes, the whole gamut. And people that do it, about 3 months prior to and including the egg retrieval, they had a higher, not pregnancy rates, higher live birth rates.
Wow. That's amazing. That's
Yeah,
the
so it's
holy
interesting.
grail. We're always looking for the live birth rates to be the gold standard of what we're trying to achieve. So that's incredible.
Yeah, so I thought it was very interesting, and they've replicated the study multiple times now. So now there's more studies and more interest looking at, can it impact egg quality? So, we're not going to say it outright, but it makes you wonder, why
So,
do we have higher birth rates?
so that's a great segue into my next question, which is what exactly do you tell your patients or do you feel that the acupuncture is doing? And how does it actually help someone going through IVF?
Really awesome question, and one that I'm addressing every single day. So, the reason why people may do it, okay, number one, you are under great stress and duress going through fertility. Like, we
Yeah,
cannot deny that.
for sure.
And as Alice Domar did a study, and other people have, in terms of like the stress of a woman going through fertility clinic and day in day out there and doing injectables and the whole gamut. The stress of that is equal to that of someone having health issues like cancer or heart disease, so life-threatening illnesses. So
Right,
we're not undermining the other illnesses at all, but we just have to own up to the fact that the stress is real, and it can take over one's life. And oftentimes people are not solely navigating fertility challenges, but then also their complicated lives. So that may include work and how to navigate that, and that may include loved ones being ill that you may take care of, or whatever else there is. And so acupuncture, we know also, when we literally, as soon as the needle goes in, we're going to have an influx of the endorphins being released, and then lowering of the cortisol levels. So that means that we're actually mitigating your physical stress response. And we
right,
know, when a lion chases an animal in the wild, for example, the animal being chased is not going to say, "Oh, it's a good time to have a baby." No, they just run and they don't think about it,
yeah,
right?
yeah,
So we think we're so highly evolved, which, we are questionable. But when we have the stresses of our lives, not a physical line, but the line of our lives that are chasing us, it has our body go into a place of that fight or flight mode,
right,
and survival mode and protection mode. And when we're in protection mode, all of our energy and our blood flow will go to what's necessary for survival, which is the
sure,
brain, the heart, and the limbs to run. So, how efficient are our reproductive organs working at the time? And the kicker is, it's like you're dying to get pregnant, so you're super stressed, and maybe your body's not working as well as optimally to receive
right.
enough.
So
Not
for
to
the
say, go
oh,
ahead.
sorry, go ahead.
No, I was just going to add in that, we also want to be careful with, oh my gosh, then that means I cannot have any stress in my life. And really, that's definitely not what I'm alluding to, because there's some studies that will say, oh, stress can impact fertility, and then others that will say stress doesn't impact fertility. And what the truth really is that it's not the physical stress, it's your actual response to stress that can have an
Right.
impact.
Right. That's a great point. Yeah, absolutely. And we see that day to day because we do talk to our patients about stress. And aside from the traditional Chinese medicine and the acupuncture approaches, we also have all sorts of resources to help our patients deal with their stress in terms of psychologists and so on, because it is really critical for sure. So, specific to our IVF patients, because that's really a lot of the patients that are feeling the higher levels of stress. Is there some kind of magic that the acupuncture can achieve? Like, can you thicken a lining? Can you help create more eggs? What sort of role does acupuncture play, or traditional Chinese medicine play in the actual IVF journey specifically?
Well, I love that you asked this. And of course, I'm not going to cite specific research papers. I'm going to incite my experience with
Yeah,
this. And what's so fascinating, and I love this. So, for example, women will come in and say, okay, Mary, my lining is zero point 0.4 right now, and we want a 0.8 centimeters, right?
right.
Before you go for a embryo transfer. And
Yeah,
so there's this, it's like, oh my gosh, like he may cancel the cycle if we don't get it up.
Right.
So what do we do? It's like, okay, you might actually need to come in every day for the next 2 or 3 days, and then you're going to do another lining check and see what happens. So we literally see from a 0.4 to go to like 0.8 to 0.9 and then some. And it's been really fascinating to see that and witness that, because so we get informed by our treatment. So when people see us, we actually ask the REs or the technicians or the nurses that are facilitating the cycle monitoring to give us a snapshot of what's going on in the moment. So for example, if a person is actually doing stimulation in their IVF cycle, I say, okay, bring your stimulation sheet. I want to know how many follicles on each side of your ovary, and depending on what's going on, we may actually stimulate one side more than the other. Right? So if there's one side that's lagging behind, we'll put more needles, and not necessarily more needles, but we may actually stimulate it more. So one side we do electrostimulation with the needles, and then the other side we just kind of leave it.
I actually didn't know that was even possible. That's incredible. That's phenomenal.
That's what we do. Like we're pretty cutting edge here, and I don't know if other people do that, but like I'm a stickler for like, let's do everything in real time and make decisions in real time.
So you're actually becoming an integral member of our IVF team that way.
Yes. Yeah, absolutely. And so I have 3 other associates that does strictly acupuncture, Chinese herbal medicine, that does this. So we all know about how to deal with this. And then like yourself, we have other people on our team doing other things as well. But yeah, like we love it. It's so, I'm going to cite this example. It was really cool. And the women watching this may find this insightful. And because of course, as you know, the thought is with every passing month, your egg gets older. And with every passing month, that means the egg quality is possibly going to deteriorate, right? That's just like a common theme, a thought pattern, a belief. So this one woman says, she's this professor, she's actually a psychologist, and she says, Mary, we are going to do 3 IVF retrievals because I am low ovarian reserve, I am advanced maternal age, and I have premature ovarian, well, was she actually? I guess she was, yeah. So, and she had stage 4 endometriosis. So she says, we're going to collect, we're going to do 3 rounds, and we're going to do PGTA, so genetic testing.
Sure.
So I said, fine. I said, you are so crazy busy, so let's do what we can do and let's make it possible. And so we did it like once a week, maybe.
Okay.
And she ended up with, and she did 3 in a row, 3 retrievals in a row. Right. So back to back, 3 months. And each time she would get consistently 1 or 2 embryos. So she would batch them, and then she would actually get it tested as a batched.
Sure.
Set,
yeah.
Right. So this first set with 3 rounds of IVF retrievals, she ended up with no normal and 1 mosaic embryo. And she came back to me and she's like, oh my God, Mary, she's like, I can't. She's like, I'm not willing to let this go. And I have a new plan. So I'm like, holy cow, you're a persevering woman. And she says, I'm going to do 4 rounds of IVFs. Right? Like, I mean, this is not the usual conversation, but I just want to say this because I thought it was so interesting. So she said, okay, my new plan is I'm going to take a month break, and I'm going to do 4 rounds of IVF. And maybe we need to level up a bit. And I said, you know what? If you're going to do that, let's go high or go home. I said, what we need to do is especially while you're stimulating, we might do it every other day. We might do it daily because you have lower number of follicles. Let's just like really juice it up, because at the end of the day, it's not the numbers, like the quantity, it's the quality. Yeah. So she agreed to it, and she started with the twice a week. And when she actually was in the stimulation phase, we were doing sometimes literally every day. And again, I told you about how we work, right? Like looking at the follicle size and then adjusting our treatments accordingly. Mm-hmm. So she did 4 rounds, and then she ended up same number retrieved, same number embryos. Right. And guess how many chromosomally normal embryos she had? And this is now at least 9 months later, by the way.
Oh, wow.
Guess how many she had?
No idea. 5.
Yes, 5
Wow,
chromosomally normal embryos, and the outcome of the actual IVFs themselves were the same in terms of retrieval
that's
and
incredible.
blastocysts. So
Night and day difference.
again, night and day difference.
Yeah.
No, do we simply say coincidence, or could it possibly have had an impact? So
Well,
we've been thinking like this.
yeah, I can tell you that that wouldn't be coincidence because we know those statistics well, and it's difficult to get 5 normal embryos in someone older who's really been struggling and just had 3 cycles of IVF with none. So that's incredible, incredible results. So I've got an aunt that's actually terrified of needles. And there are certainly some patients that don't love needles. Now, they obviously get used to it going through IVF, but does it hurt much when you get this? Like, what do you do for someone that isn't really a huge fan of more needles after they've already sort of been jabbing themselves with needles for days?
Yes, it's a really, really great point and a really great question. So number one, who does it counts, meaning did they just dabble in acupuncture? So no offense to
Mm.
chiropractors, no offense to physiotherapists, no offense to naturopathic doctors, but the level of education is different.
Okay.
And so for someone like myself, as when we go through school, then the hours that you get for actually practicing acupuncture is like in the
Right.
maybe 3,000 hour range. Whereas,
Wow.
a physio, they can do like a weekend course, or a
Okay.
physician or a dentist, they can
Sure.
do a weekend course. A
Practice makes
chiro,
perfect.
yes, exactly. That's really what it is, right? And then so that's one thing. And then the type of training, the understanding of what's behind it. So again, in the kind of training that you get, you may not get the traditional and the real reason why you do certain points. So point selections, um, and then also we're going to look at, so okay, who makes a difference. The so the number of years of experience makes a difference, and you got to know the needles themselves. They can be very thin. The gauge of needles can make a difference depending on the practitioner. I've been doing this for so long, I can use the thickest needle and you may not feel anything, right?
Right.
So
Right.
it's the technique as well. And then just so you know, for those who have never had acupuncture, it's filiform needles, so there's nothing to them. It's not like a hypodermic needle where it's got a hole, and either you're injecting something like fertility drugs or you're withdrawing blood. These are literally fine needles as thin as your hair. And where we insert it, we don't aim for nerves, we don't aim for blood vessels. So we literally tap into the fascia tissue, which is just above the muscle layer. And
Right.
in that area, we say it's the most electrically active. So it can literally
Wow.
activate and stimulate the neurotransmitters, which will communicate with the brain, and then the whole hypothalamus, pituitary, ovarian axis. So it can impact the cascade of hormones, it can impact pain levels, and I told you earlier, it can impact the stress response, right? Like that.
Yeah. Yeah. Amazing. So, in terms of the non-acupuncture side of things, when you're looking at the Chinese herbal medicines, people always ask us, are these okay when you're doing IVF? Are these okay, to mix while I'm taking my shots and so on? Are these okay for my frozen embryo transfer? So I always reassure them that it should be okay because, I don't think there's anything out there that's contraindicated. But can you tell us a little bit more about that?
Okay, well, first of all, I want to acknowledge you for saying this. And I really say that from the bottom of my heart, because oftentimes then, when you don't know something, the automatic is a defensive saying, no, just don't do it. A lot of doctors will say that. A lot of our patients get this.
I'm a lot
And
more
and
open. So,
yes, and we want full disclosure. I don't want to be behind people's backs. I'll say, you know what, you might want to tell them, and like I leave it up to you because this is your decision, right?
sure.
And at the end of the day, like so in China, how it's done, it's side by side, right? So they are doing TCM,
Right.
acupuncture, Chinese herbal medicine, and
IVF.
Western medicine
Wow.
simultaneously, IVF, ART.
Amazing.
And so I think it also, again, depends on, so you would want to choose an acupuncturist or a herbalist that actually know what the heck you're taking. Because if they don't, then I question their ability, because, you know, for example, when you're taking gonal F or other fertility drugs
Yeah.
in Chinese medicine, we're saying that we have to kind of like transform the conversation into Chinese medical terms.
Right.
When you're using FSH or Menopur, all that kind of stuff, you're trying to develop the egg, and we say that's very yang, very action oriented, very hot, and
Right.
so we don't want to use those kind of herbs because basically we're just putting fire on fire. So we want to actually help to not over drain, right? Like we support in a different way. We don't want to use the same actions. So you actually need to know what you're doing. So when you say, can we blindly say take the herbs? I would say no, right? But yet simultaneously, and if you're doing what I call the barefoot doctoring, and if you're looking up on, oh, this herb looks good, and you just try it, likely you won't hurt yourself because dosage also matters. And typically what you would get and you cook with, it's not necessarily a therapeutic dose. So so again, my advice is to find a herbalist that knows the drugs and any kind of interactions and go from there, and then you can trust that.
So are there, just final question for you, and thank you so much for bringing all of this to our attention. It's really valuable. So how do you actually find the herbalist or the traditional Chinese medicine specialist that you can trust? Like what sort of qualities should we look for, or should our patients look for when they're searching for someone?
Yeah, I think that's a really great and important point. So when you search for someone, for sure, you want them to. So some people now, because it's like fertility has become a thing, and then everybody can just put it on their shingle and say, I deal with fertility. So what you need to do, you might want to actually shop around and test them a bit. Like, do you work with people that are doing IVF? Do you know what the STEM protocols are? Like, and you'll get a sense of that. And if they have experience with it, of course, that's a big bonus. And there's an association called the American Board of Oriental Reproductive Medicine, and I belong to that, and some people in Ontario do as well. But they're few and far between. So I don't think it has to be just us. But the difference, perhaps, is that we literally wrote exams on reproductive endocrinology, so we actually know what's going on, right? Wow. And then we also know the Chinese bit. So integrating, marrying the two, I believe is very important. So short of that, you want to find an acupuncturist. So let's say you're in a remote place and it's like, oh crap, I only have this kind of practitioner. What do I do? And I want to get acupuncture. So they might be advised by another one if that would work for them, because we do that as well. We'll actually counsel other acupuncturists, and they'll come to us, or if they're working with other patients. Yeah.
So you're the reference.
Pardon me?
You're the reference.
Yeah, well, not all the time, but sometimes. And
so if our viewers want to get a hold of you, how should they do so? And if they want to access you online, can you just tell us how to do that?
So our website is aliveholistichealth.ca, and but I'm on Instagram, so you can just find me at Meet Mary Wong. And as Dr. Victory said, I also do a thing called Fertility Talks myself. So we have like lots of different viewpoints. And so you can check that out at Meet Mary Wong on YouTube channel as well. And one last thing, for those, what I call the needle shy people, there are other alternatives too. So it doesn't strictly have to be acupuncture. You can do laser acupuncture if people are doing that. You can do acupatching, which is another thing. So there's no needles involved at all. And again, you can find that out. You can contact us, because I don't want to take too much more of your time. And
no, not at all. It's been amazing. You really opened some whole new doors for us to how we can help our patients. So I never even knew about being able to adjust one side versus the other. So that's absolutely phenomenal. So I can't thank you enough for joining us. Thank you so much for being actually our first interview on Fertility Fact or Fiction. We don't traditionally interview, but I thought this would be a great way to start. So thank you so much for being our very first. That was amazing.
Wow, I'm so honored. Thank you for having me and doing this then. That's great. I love it.
Thank you.
Yeah, I'd love to do it again. We can talk about something else.
Absolutely.
Eastern and Western perspectives, right?
Absolutely. You know what? Maybe I'll get you to do my shoulder and then we can do that live and we can post that up. So, yeah, thank you so
Totally.
much for joining us. Really, really honored to have you on the show, and keep doing the great work that you're doing. And for any of our viewers that are watching in the Toronto area, that's Alive Holistic
Alive
Health,
Holistic
right?
Health.
Yeah. So for sure, reach out to Meet Mary Wong on Instagram, and we will definitely have you back on. Thank you so much again. Have a great night.
Thank you. You too. Take care.
Okay, take care. Bye now. So that was amazing. I had no idea that people are doing that. We do have our wonderful team here, and we do have some acupuncture work being done here in Windsor. Mary's obviously in Toronto, doing great work for all of our Toronto patients. So that's incredible, and I gotta start looking into this even more now to see what kind of work we can do with acupuncture to try and alter the outcome. So wonderful to have her on the show. So we're going to start taking your questions live. I am assuming that there are many up. So Tarek's going to start asking, and we'll go from there.
First question.
Yeah.
How many eggs should a 37-year-old freeze for one possible baby?
Oh, so at 37, you probably need somewhere around 20 to 25. We actually have a post on this on our Instagram account from a long time ago. It's actually a chicken egg that's frozen. So it's this really cool, like yellow frozen egg. So it's way, way back. But at 37, you probably need somewhere between 20 to that it is involving having two in a row, and some say three. So for us, we now go with the two because when they looked at the yield in terms of what you're going to get from the testing, there actually wasn't very much of a difference between having two in a row or having three in a row. So that study in particular said after two, you're probably okay to go ahead and check and see what's going on. So there is a huge, huge realm of possibilities as far as what is causing recurrent pregnancy loss. And as a result, there are a lot of tests that can be done, not necessarily have to be done, but can be done. There are some basics pretty much all of us use, and there are some more sort of funky things that some people believe in and others don't. As far as the rabbit hole comment, I don't actually agree with that. So we do have patients that have had amazing successes after multiple failures. And I work closely with my colleagues in Toronto, Fred Zineku and Chloe Romain, who are amazing, amazing reproductive immunologists. And so they do some great work, and we have them collaboratively working with us on the patients where we think there is an immune problem or they've had recurrent pregnancy loss, and we've tried our tricks and they're not working. I will tell you that I've actually never had a patient I couldn't keep pregnant, except for one. And we managed to get that individual a baby too, but we did have to use a surrogate. So for everybody else, we have ultimately managed. And so we've done really, really well in that regard, and we're willing to keep fighting for you if you're willing to try. So I don't believe there's a rabbit hole issue there. I think you actually can find ways to help. Some of them are a little out of the realm of normal, there's no question, but there are ways, and more every day, the science is getting stronger to support different approaches and different techniques and different treatments. So I definitely think if you've had two in a row and they're really unexplained, it's worth investigation before you spend more money on more IVF or more IUI or whatever the treatments are, not knowing what's going on. Even if you're doing it naturally, you should have some answers before you continue losing, more pregnancies, unfortunately. Yeah. Great question.
We have a acupuncture question.
Oh,
and
sure.
Mary's actually still on as well. I can put her back on if that's okay.
Yeah, sure. Yeah. Bring Mary back on. She can answer the acupuncture. Mary, we're bringing you back on.
Okay, so the question is, I guess the question for you, Mary, is I recently started acupuncture and preparing for my upcoming retrieval. At my ultrasound last week, it showed that I was ovulating despite being on BCP for several weeks, so my cycle was canceled. Could the acupuncture have played a role in BCP not suppressing my cycle and my body just doing what it would do naturally? The naturopath had some knowledge in fertility, but we do not have a fertility-specific naturopath acupuncturist where I live.
Mhm. That's a great question. And I'll say, it's true then. Your body has been working in a way that was going to do what it's naturally going to do. I don't think acupuncture would be strong enough to override the drugs, to be honest. So perhaps sometimes the birth control pill may not actually be as strong for an individual, and you may still ovulate despite that. I mean, you might hear some people say, oh my gosh, I got pregnant and I was on the pill, right? You might have heard of that. Those people that we're jealous of. Yes, that like that.
Great. Yeah. I mean, all of these things are adjuncts that really can be put together to get the outcome that we want. It's not like the sort of Western medicine approach is always successful on its own. We need the Western medicine. We need the holistic approaches. We need the traditional Chinese medicine approaches as well. And all together, they kind of fit the pieces of the puzzle. I always believe in that kind of holistic approach. I don't think taking just a one direction approach to things, works. Usually we need all the approaches. Yeah, great question, and thanks for jumping back on. Yeah, another one.
Another question.
Sure.
I think that's all of them though regarding acupuncture specifically.
Great, thanks, Mary. Hang on to the show.
Oh, no problem.
If somebody else has a question, we'll bring you back on.
Okay, next one. Can you discuss taking letrozole during an FET? I was prescribed letrozole for my upcoming FET.
So there is data out there that actually a patient brought to my attention. So here's how we always learn. So a patient mentioned to me that they had been told to use letrozole, and I went and looked it up, and there are actually numerous studies. And as always, we have a fact or fiction on letrozole use and doing a frozen embryo transfer. So there is good data that actually supports the fact that letrozole will significantly improve your success rates. The mechanism has not been worked out clearly, but the outcome was actually very obvious, statistically significant, that there was an increase in live births. So we now have implemented that into all of our cycles. And I have to say that in large part, thanks to our amazing team, including our phenomenal lab director, Dr. Khosravi, we are getting the highest success rates I've ever seen. So we are doing amazingly well. I think we have really kind of hammered down our FET protocol to the point where it's, just shy of perfect. And so we've got all of the little pieces in place actually from doing this show. So, from all the things we learned to bring to you guys and talk to you about, I've actually compounded all of those together to come up with an amazing frozen embryo transfer protocol. Our success rates overall are about 80%. So we are doing incredibly well and are very, very pleased. Yeah.
I have a acupuncture question.
We're going to torture poor Mary. Mary, you're going to be jumping on and off the whole show. So come on back.
Okay, that's okay.
Okay, so the question for you, Mary, is how about acupuncture for IUI?
Oh, well, it wouldn't be that much different, right? I mean, again, research is research when there's more money at stake. So typically when people do research on acupuncture and fertility, it's going to be in adjunct to IVF. So really, egg quality is pertinent no matter if you're trying naturally or if you're doing an IUI or if you're doing an IVF. There's no difference. And so obviously, though, when you're doing an IUI, you're not looking to have a gazillion eggs. You're just, maybe wanting to perhaps 3, perhaps 4, depending on your age. So the how we do it may not be as intense in terms of having to know, which side do we have to stimulate more. We may do it more equally, but it is still individually based. Yeah.
Awesome. You can flip us if you want.
I've been flipping.
You've been flipping.
I've been
flipping.
flipping.
All right, great.
Okay. Pros and cons of vaginal progesterone. I just found out I'm pregnant after having a miscarriage in December. Would you recommend this?
Okay, so this is a hot button topic because the studies that have always been done on progesterone have failed to show a benefit in preventing miscarriage. However, they all started too late. So technically speaking, if you're going to start the progesterone, it should be started the day after you conceive. And I believe it does reduce miscarriages because our miscarriage rate is actually quite low. However, I think it's really important that when you're looking at the data, we look at the data correctly and with open eyes and understand what it's shown. So it's critical to understand that the studies don't support a difference. I actually believe there is one. I just don't think people have done the right study because they're capturing women after they report that they're pregnant. And at that point, you might be 4 weeks, 3 weeks, 2 weeks, 6 weeks into the pregnancy. Oh, I'm pregnant. I just found out. And now we're going to start you on your progesterone. By that point, there are so many metabolic changes, hormonal changes, implantation differences, enzymes, proteins, all sorts of mechanisms in place that the opportunity for the progesterone to have its salutary or beneficial effect may have been passed, or you may have missed the golden opportunity, that window of opportunity. So I think that there is a really critical time issue with this. And so if you can start it early, I would. If you're starting it late, it's certainly not going to harm anything, but it's probably less likely to be effective.
When starting IVF in Windsor, how long does it take from reviewing, signing forms to starting stabs?
Yeah, probably about a month. So once we've gone over everything, within a month to 6 weeks, we can probably have you ready to go. It's relatively quick. We just are very careful about our IVF. Listen, I get it 100%. I understand the pressure that's there for IVF. But as Mary was saying, and if any of you were on earlier, we had a yoga for fertility we were on together. The reality is that if you are stressed, if you are experiencing stress, if you have that reaction to stress, the problem is that can have detrimental impacts on your fertility success. And so the problem that we run into is we've got patients that think time is so important that they need to plow through their IVF cycle, and they are under the gun the whole time, and that is not a good way to do an IVF cycle. You need to take the time to go through it calmly, be aware of what you're doing, feel comfortable with what you're doing. If you feel like you are under such time constraints that you have to plow through the cycle, I guarantee you're going to have a much different outcome than otherwise could be achieved. And you will have a lot of resentment and grief and frustration if it doesn't go right. And you're placing yourself in a position that is going to make it much more likely it won't go right. So we really believe in taking a cautious, gentle approach. And I don't know how Mary feels about that, but Mary, feel free to chime in there. I'd love to hear what you think.
I got a little distracted there, but so I wasn't fully paying attention. Can you give me the Coles Notes version?
Yeah, so I was just saying, if people are trying to rush through an IVF cycle, it doesn't always work. A lot of people feel like they're super pressured. They're asking how long from the time they see us till the time they can start their IVF cycle. And I was just saying, the high pressure, pressure cooker approach to IVF, I find is a recipe for disaster. I think just taking your time, knowing that you're, going to go through it cautiously, knowledgeably, and calmly makes a big difference, because if we can alleviate the stress and you go into the cycle more reassured, I think patients have a much better outcome.
And I thank you for addressing that, because this is the kind of conversation I have, again, daily with our patients, because the mindset is, again, every passing month, I'm getting older, my eggs are getting older. And without the thought of, in actuality, if your germ cells are going through folliculogenesis, there's a time frame in which it goes from germ cell to that ovulating egg. And perhaps just perhaps our lifestyle, our diet, our mind, our belief system, the acupuncture, the herbal medicine, the supplements that we're taking, the therapy that we're doing, that might actually add to the picture so that by the time you do your IVF or an IUI or whatever you're doing, you might have a better outcome.
Amazing. Yeah. Next question.
Hi, Dr. Victory.
Hello.
How many days of progesterone would you recommend prior to a fresh transfer?
So we've got a video on that as well. That's one of our bigger videos on YouTube. It has the number 6 or 7 because it's just the days. It's not actually how many days of progesterone you would use. It's which day you'd have your transfer. But it reflects doing 5 days or 6 days of progesterone. So if you have a day 5 embryo, you can have 5 days of progesterone prior to transfer or 6, and it makes absolutely no difference. But if you have a day 6 embryo, the study that we reviewed actually said that you should do 6 days because it reduces the miscarriage rate. So that's traditionally what we've done with very, very good success. I know most places just go with the 5 days, but there's probably something about your embryo if it took 6 days to get there. So maybe that day 6 embryo, many of which will turn into viable, healthy, wonderful children, that needs 6 days of progesterone as well, because biologically, yes, it developed in a lab, but it took 6 days to develop. In your uterus, it would have implanted or landed in the uterus a couple of days earlier, and the progesterone already would have been there. So biologically, if it's a day 6 embryo, it probably makes sense that it needs to be exposed to 6 days of progesterone. So that's typically what we do. So 5 for a day 5 or 6, 6 for a day 6.
When trying to conceive, when, if ever, is it okay to have a bath?
So you can have a bath whenever you want. It's actually not the bath that's the problem. It's the temperature that's the problem. So if you're having a super hot bath, like my wife likes to come out of the bath like a lobster, then you're drawing blood flow away from your core organs because it has to come to the surface of your skin to try and cool. And so that's not ideal, obviously, because you're drawing blood away from your uterus, from your ovaries, all of those things. Now, no one wants a cold bath, but at the same time, you don't want to go into one that's piping hot because that probably doesn't make a lot of fertility sense.
Is the Johnson & Johnson vaccine as well accepted as safe for those TTC with infertility?
Yeah, so I don't know a ton about it, but my understanding is it's essentially a traditional vaccine, which is like fragments of the virus. Excuse me. So I don't believe that there's any harmful side effects to that because it's not a live virus. It's not going to do any damage to you. So it's like you're getting either a attenuated form of it or you're getting just fragments of it. I don't have corona, I'm vaccinated.
What would cause an IVF cycle to be canceled at baseline?
Hormonal abnormalities, cysts, you've got no eggs in the ovary. Some people follow your FSH levels, and if they're too high, they don't begin. I think that's an utter waste of time. But there are different strategies and different sort of markers that we use. So the main one would be if you see a cyst or if your estrogen level is too high, because it means you may be more advanced in your cycle than you're supposed to be. And that can really kind of gum things up as you go through.
Do you suggest using Femera or Clomid for an egg retrieval if you are in your 40s with 1.4 AMH and 10 eggs? Should we take Femera or Clomid for an egg retrieval any side?
Okay, so if you have 10 eggs, you don't need Femera or Clomid because you should be able to take the injectable drugs and get 10 eggs. So I'm not sure if I'm understanding your question properly. For an egg retrieval, Femera or Clomid, Femera, by the way, everybody, is letrozole, is not used for people that have 10 eggs. It's used for people that have like 2 or 3, in an effort to try and see if we can get more. So every technique out there to stimulate women with diminished ovarian reserve or ovarian insufficiency has been tested, and many of them have been compared to one another. So you've got your microdose Lupron flare protocol, you've got your letrozoles, you've got your clomids, you've got antagonist cycles, and then I just heard recently that in Las Vegas they're doing the long agonist downregulation and then switching to Cetrotide, which in my mind makes no sense. So bottom line is none of them make any difference. They've all been trialed, they've all been compared, they all give you the same outcome. So it doesn't really matter. It's not like somebody found this amazing protocol that works for everybody. Medicine doesn't work like that. Everybody needs to be individualized, and you need the care that's right for you. So just like, our amazing guest tonight, Mary Wong, was saying earlier, each patient is individualized for their acupuncture. Well, each patient needs to be individualized for their care when they're doing IVF. From the Western side of things too, we always say we're not baking cookies here. It's not cookie cutter medicine, right? We're making babies. So you need to have the appropriate approach for you. And for one person, that might be letrozole. For the next, it might be Clomid. For one, it might be natural IVF. And for another, it may be the microdose flare. We tend to use the microdose flare the most just because I've had the most success with that. So that's kind of our go-to. But I'll play with dosages. I'll play with medications. We'll do natural cycle IVF for a lot of our patients. Yeah. Great question, by the way.
Supplement suggestions and recommended dose. Taking CoQ10, magnesium, folic acid, omega-3, and vitamin D. I'm 28 and have PCOS.
Okay, so omega-3s, you got to look at each one, but I think it's 2 or 3 milligrams. CoQ10 is 600. What was the other one?
Folic acid?
Folic acid, anywhere from a minimum of 400 micrograms all the way up to 5 milligrams. Yeah.
Omega-3?
I already said that one.
Vitamin D?
Minimum 2,000 units a day. But get your vitamin D levels checked, because your vitamin D levels are critical to your success, and we want you to be sufficient. So vitamin D has deficient, which is less than 50 nanomoles per liter. There's insufficient, which is 50 to 75, and then there is sufficient, which is above 75. So make sure you're in the sufficient range.
What does white blood cells in a semen sample mean for fertility?
Probably that your husband or partner is exposed to some degree of either inflammation or infection, often from the prostate, but not always. So we frequently will treat those men with antibiotics and recheck. As you can imagine, if there's white blood cells there, white blood cells are there to fight infection. So if there are white blood cells there, you want to make sure there's no infection, because infection in sperm is obviously going to lead to negative results. So we tend to treat our patients when we see that there.
What's the odds of a 42-year-old to get pregnant through a sample donor?
I love and I am terrified of these what are the odds questions. So listen, the standard response to this is I left my crystal ball at home today because there's no way to answer that question. There is no 42-year-old that is the exact same as any other 42-year-old, and it depends on so many different factors. How the sperm quality is, what the egg quality is like, what the rest of your health is like. So at 42, doing insemination with donor sperm, realistically, your chances are relatively slim. Most studies would say somewhere around 10% overall, and that's probably after several tries. That's doing IUI. With IVF at 42, it very much depends on the center you're going to, plus all of the other factors. So it's very, very difficult to kind of quote you a person-specific number. You should watch our video on embryo math, though. So on our YouTube channel, we came up with this great video and a PowerPoint presentation on how to calculate what your chances are and what numbers you need to understand in order to know what your specific chances will be. So watch the video, because it basically will answer it for you there. We've got all sorts of really great graphs. We've got numbers, examples, everything. Watch that video. Tarek will put the connection right there when this goes on to YouTube. But you will see it there. You can do it now. You did it last time. It's the embryo map.
This is
a whole other level.
the hosting's complicated.
All right.
But it looks good. From Instagram, when working with older women, it's somehow related. What is the ideal goal for follicle size if the goal is quality over quantity? Thank you.
Yeah, so we do tend to trigger a little bit earlier for women that are older. I once spoke with the great Richard Scott, who runs RMA IVI, or is it IVI RMA? He's definitely, if not the smartest man I've ever met, certainly one of them. And he actually said they trigger at 15. I admittedly think that's aggressive. You'll probably get a lot of immature follicles at 15. We tend to go more for like a 16 to 18 range when we're dealing with women who are older. Because if you wait too long, you will get more eggs, but the quality is shot for sure. Great question. That's a phenomenal question. Share that answer with everybody. You guys should all be passing that around. Because a lot of centers don't realize that that's an issue and they keep trying to get more eggs. You're not getting more eggs, you're getting worse eggs. And you could have 100 bad ones and one good one, and the one good one will work. So don't go for more, go for quality.
I apologize, Dr. V, not a fertility question, but are Remicade infusions safe during pregnancy?
Which site?
Remicade?
Oh, Remicade.
Remicade.
That's one you need to talk to your doctor about, because people that need Remicade actually usually really need Remicade. We don't traditionally use it during pregnancy. If you can avoid it, you should. But if you need it, you need it. And we always have to balance your health versus the baby's. You guys can ask me OB questions. I look exhausted because I was up all night delivering babies. So I am very fond of taking care of obstetrical patients. And I even take care of my own high-risk obstetrical patients all the time, twins, triplets, all that stuff. So go for it.
Interesting question.
Okay.
Do you and Dr. Pattinson have the same embryologists?
Yeah, we do. So it's actually our center. The amazing Dr. Pattinson is my sort of partner, not in business, but partner in crime, so to speak here. So he works here as well with the Pattinson Clinic. And Dr. Khosravi, our lab director, is our lab director. So she does all the cases and she does them herself, and she is spectacular. I have a lot of respect for embryologists out there, but she is a phenomenal embryologist, and we all love and respect her tremendously. She is a really, really skilled individual, knowledgeable, and keen and eager. Like, she wants you to succeed. And she really takes it to heart when, we don't have the outcomes that we want. And most of the time she's had the best outcomes I've ever seen. So just to give you an example, the last 2 weeks, we had her come to us 3 times telling us that not only did she get 100% fertilization, she had 100% of the embryos become blastocysts. I've never seen that before. It's incredible. So she's doing amazing, amazing work. It helps having a great lab. It helps having a great team. But we really communicate every day. She tells me what she wants. I tend to listen. So it works out really, really well. So far, so good.
I'm being induced via Foley this weekend and want to know if there's anything I can request to take to find the insertion of the Foley more comfortable.
Oh.
I take birth pain over cervical exam pain.
So you're not getting a cervical exam. Putting in a Foley involves putting in a speculum, opening it up a little bit, not enough to make you uncomfortable, hopefully. Finding your cervix, just passing a tube that's about the size of a thin pen, a little bit thinner than this kind of pen. This is one of those Staples Postscript pens. I have no commercial bias here. So it's about the same thickness of that. And then it just goes in, and the balloon needs to go past your cervix. So if they try and inflate it in your cervix, that will hurt like hell, and that is the wrong thing to do. The point of the balloon is not to dilate your cervix. It's to push the membrane the baby is in away from your cervix, which releases prostaglandins, which then puts you into labor. So actually, it's not painful going in usually. I've never had anyone scream and shout about the Foley insertion, and it is way less painful than having your labor pains. So most people tolerate it very well. Make sure they warm the speculum. Make sure they explain every step of what they're doing. Make sure they're gentle. All those steps you take, and it works out really well. We do it all the time.
I got a slew of acupuncture questions that just showed up.
Bring Mary back on. Mary, I hope you're ready to go again. This show goes forever, by the way. We normally.
Okay, I can't say forever. I can't say. I do have a little one I need to take care of, but I'll stay on for a little bit.
So the question, Mary, is when should someone have acupuncture after FET?
After FET? So that's interesting. So, I mean, my advice would always be doing it prior. And then once you're there, like while you're in your 2-week wait, we'll do it once before you actually get your results. And hopefully when you're pregnant, we actually keep people doing acupuncture for the first trimester on a weekly basis.
Oh, wow.
Number one, again, back to the keep you calm, because people are pretty stressed, very stressed during the 2-week wait, and also super stressed and equally stressed when you're in that early part of pregnancy. So we want to really keep them calm, keep everything, what I say, juicy. You want to still keep on having that juicy uterine lining, because that's what feeds that developing embryo in the early stages before the placenta kicks in.
Great.
Got another one.
Yeah, far away.
Acupuncture question. Do you suggest that someone with epilepsy do acupuncture to help with their fertility?
Oh, great question.
Sure, why not? I mean, in fact, so epilepsy is one thing, but there's lots of different scenarios, right? So it's not just epilepsy, but gosh, like you name it, we see it, to be honest. And I mentioned it earlier, oftentimes people come to us and their last leg, right? Like literally I've tried everything and they're always asking me, am I the worst case you've ever seen? It's almost like they want to be the worst case. And yet, so we've seen lots of women with, or have had epilepsy, whether it's controlled or not fully controlled.
Okay. And I think this is almost the exact same question, but they wrote it, so I'll give it a special thing since Mary is here. Acupuncture question. As a person with epilepsy, will acupuncture help the same ways and can affect their epileptic stability?
Oh.
So same ways, meaning that as effective as someone without epilepsy? I would say yes, but again,
I think they're asking if it'll actually reduce their epilepsy.
Possibly. Yeah, because we have people that come in not just for fertility, right? So, if there's I would never go to someone and say, oh, you have epileptic drugs that you're on. I'm not going to say, oh, let's just stop that and do acupuncture.
Right.
Right? Like you might want to do it in conjunction. And when you actually see if things starts to recede and the seizures stop happening or whatever, then we might consider and talk to the physician, the guiding physician, say, I wonder if we might go down.
Right.
So we certainly see that. And again, back to any kind of condition, because of course, when we're trying to conceive, we want to minimize the influx of drugs that we're taking. And then sometimes it's actually really crucial to, take the drugs that you're on, including like antidepressants. If you have, now we're kind of going off tangent, but in this climate, there's a lot more depression, anxiety going on. So some people are are experiencing major depression. And when we have major depression, sometimes the drugs might be more of a benefit than without, right? There's studies on that too. It's like, without or with, while you're pregnant, sometimes the outcome is more severe if you're not on the drugs.
Right.
So having said that, so you can add acupuncture to the picture and you might reduce it.
Awesome.
If that makes sense.
My treatments have been put on hold due to high reverse T3. Can acupuncture help get this down?
Where's your crystal
grilling you
ball?
tonight, Mary.
I'll say maybe, and again, we don't know until we try, right? And like with the high T3, people will say, Mary, here I am, I want to conceive, but I really want to avoid drugs. And I'm thinking, gosh, like you want a miracle and this, I feel like the more technology we have, the more impatient we have become. And by that, I mean, it's like, I want that T3 to come down spontaneously. And when we're dealing with natural things, like, yeah, maybe like if a miracle happens, it can. But most likely, if you're not in a position of trying to conceive, then I say, okay, let's try it naturally. But you're actually in the position of, I want to try now and yesterday to be pregnant. I'll say, you know what, you might actually just surrender and take some like low dose, drugs. And then again, we'll work with the acupuncture. So I'm very a realistic person about this because I don't want to waste anybody's time.
Awesome.
Right.
Yeah. And as are we on our
end. 9:04. That's for the record.
10 more minutes.
Okay.
This is the Tarek picks his favorite questions point.
Yeah. Rapid fire.
Or do you want to do the rapid fire again?
You want to go through it on Instagram?
You want me to do the rapid fire Instagram?
Yeah, sure.
I can do that.
I don't think there are any more questions
disconnect.
for. No, it's okay. You can just
nothing more for Mary.
Oh, I see one for PMS and acupuncture and birth control. Something like that.
Oh, sure, go for it.
You just put it in there yourself, Mary.
Priscilla, my name's not Priscilla.
That's true. All right, here's the question. So relief for PMS, PMDD symptoms, acupuncture, birth control pill, SSRI.
Right. So that's actually a question for both you and I. Yeah. Right. So it's like, can acupuncture help? I would say yes. Right. And in fact, again, like, what are the symptoms? Everyone experiences PMS in a different way. So we've certainly dealt with PMS, mood swings, pain, spotting, even like irregular menstruation. And now going beyond PMS, we treat people for PCOS, endometriosis, adenomyosis, fibroid cysts, like you name it, we see it. Insomnia, right? That can be part of PMS as well. So yes, we do treat it.
Okay. You want to go on there, Doc?
I'm gonna do rapid fire questions, Mary, because we only got 10 minutes left.
So you go. Thank you.
Yeah.
Awesome.
So thank you again so much for joining us. You're welcome to stay on, but if you need to go, I understand totally. We will definitely have you back on the show. Okay, folks, here we go. Instagram. Why do I do retrievals in batches? So there are some studies that shows that it improves the outcomes. And it gives us some quality control improvements because we're kind of doing everything over and over again in the same way. And so there are benefits to doing it, but we don't batch everybody because some women's ovaries are not suitable for batching because you have to use the birth control pill or down regulation. We just don't do that for everyone. So, we do it for a lot, but we don't do it for everyone. Just found out my AMH is 32. Things I read say this is bad and some say great. What does this mean? It means you have very strong ovaries, Nikki D. Cox. So don't worry, you're in good shape. You probably have very strong ovaries. You can produce a lot of eggs. That's not high enough to be bad, so don't worry about it. In what circumstances would I suggest a mini IVF? So we just reviewed this last week. I'm not a huge mini IVF fan because, to be honest with you, it doesn't make sense to me. Mini IVF really is the situation where you're giving very low dosages, but you're anticipating you're going to get very few eggs. If you can get 9 or 10 eggs with a low dose, then get 9 or 10 eggs with a low dose. The study we reviewed last week said you need at least 9 and preferably sort of 12 in order to get optimal outcomes. To get 12 eggs on a low dose, pretty much every patient has to be a very good responder. Most women need more than that to get 12 eggs. Having said that, if you can achieve it with a low dose, then use the lower dose. Why spend more money for something you don't need on all those expensive drugs? And why expose the ovary to more drugs if you don't need more drugs? Certainly, there are more and more studies coming out saying that the sweet spot for the number of eggs to achieve the highest numbers of pregnancies is between sort of 10 to 15. So whatever dosage you need to get there, get there. But I'm not a huge proponent of mini IVF in the idea that we're only going for 2 or 3 eggs. Mini IVF with low doses, I only use the dose we need for all of our patients. What is a microdose flare? It's using tiny doses of Lupron to take advantage of the fact that it pushes your ovaries quickly. And what medications? I just answered that. How do you look up the YouTube channel? www.youtube.com/DR Victory. So you can find us there. Looking forward to these live videos every time. You are so knowledgeable. Oh, thank you. Thank you so much for sharing and answering the questions. God bless. God bless you too. Thank you. Lisa at your clinic is absolutely amazing. Don't say that because I will never get her head through the door. Just wanted to give your amazing staff a shout out. Thank you. You know what? Lisa is amazing, and she is our nurse manager. We love her. Although I love all the girls here, everybody here is amazing. So they're all really, really hardworking individuals, and we've put together an amazing team. We already answered the birth control prior to retrieval. We do that for batching and to control hormones and prevent cysts. Is there any holistic medicine for someone with endometriosis and adenomyosis? Yeah, so traditional Chinese medicine has things that they can use. Naturopaths have things that they can use. NAC, which is N-acetylcysteine, is very good. Curcumin or turmeric is very good. Coenzyme Q10, the omega-3 fish oils. All of these things are sort of holistic approaches that do have benefits for those patients who have endometriosis. Adenomyosis has less information on it, but it's kind of the same as endometriosis, just in a different location. It's in the uterus. So there are approaches you can take to try and help that. If BCP did not work for retrieval, would you suggest BCP again or switching to a Lupron protocol? BCP worked for my first retrieval last year, but not this past cycle. Not sure what you mean by worked. Do you mean it didn't suppress you enough to go ahead? You probably just had not enough of it, or it didn't start at the right time. So I'd probably just try that again. Why would doctor recommend Femera or Clomid if you have 10 eggs? I don't know why your doctor recommended that. That doesn't make sense, to be honest. Side effects, Clomid makes you moody. Letrozole tends to have very few side effects. Clomid can give you headaches, stuff like that. I did it.
You're amazing.
You want one more question?
We
got 4 minutes left.
Okay.
To get to 9:15. Here comes the Tarek question of the night.
Oh, the pressure. All right. I'll display for everyone to see.
All right.
We got pregnant with a medically assisted IUI.
Okay.
I'm 2.5 months postpartum,
Okay.
and I'm anxious to have baby number 2.
Okay.
Are there any tips I can do to help my odds to get pregnant naturally?
So you got to be finished breastfeeding, and we want you to breastfeed for 6 months. So you should be breastfeeding for 6 months because that is what's best for your baby. So assuming that you're breastfeeding, finish your breastfeeding for 6 months. In the meantime, make sure your partner and you are doing everything possible to stay as healthy as possible. No smoking, no drinking, no marijuana use or drug use. Healthy weights, healthy diets, low cholesterol, low sugar. Low carbs, and lots of vitamins. Have sex every 2 days. Yes, the entire month, every 2 days. And then, just kind of continue trying. The vitamins we tend to use, obviously we do cherry pick based on whatever your diagnosis was originally, but we use the folic acid in the prenatals. With the prenatal, we often give iron, because there's some data coming out on that. Vitamin D for sure, coenzyme Q10, and the fish oils. Those are kind of the basics. Melatonin as well. One more?
You ready?
I'm ready, man. You got 2 minutes left.
What FET protocol would you recommend for a 30-year-old with recurrent implantation failure? 8 failed transfers so far.
Wow.
Unexplained other than advanced age.
I wouldn't explain any protocol. I'd recommend you get tested to find out why. So those are great cases for the Fertilysys testing, www.fertilysys, fertilysys.com. They have a test called the Hidden C. They also do the immune system testing. You need a lot of investigation before you do anything. Nobody should need to go through 8 embryo transfers without an answer. And actually, I get really upset about the places that just keep transferring embryos because that doesn't make sense. So Richard Scott, the guy I mentioned earlier in the show, has a great study that we reviewed on the show showing that even with no adjunct treatments at all, if you have 3 genetically normal embryos, you should be getting a 95.2% chance of success. That's with no extra treatments. So if you know you have genetically normal embryos and you are doing, embryo transfer after embryo transfer and it's not working, something is definitely wrong and it needs to be evaluated. So whether it's your lining or your immune system or the sperm quality or the egg quality or whatever it is, or the embryo quality, you got to figure it out. And I always talk about 3 elements to an embryo transfer. There's the passenger, there's the passage, and there's the destination. So the passenger is your embryo. It's got to be a good passenger. The passage is us. We got to do a good embryo transfer, and then everything has to go smoothly. It has to go in the right place. And finally, the destination. So your uterus has to be prepared properly. Your immune system has to be favorable. Your blood needs to be favorable. You can't have clotting disorders, thrombophilias, things like that. There are loads of elements to you that are important. You can't have infections, inflammation, any of that stuff. So there's a lot to this. It sounds really simple when I break it down into 3 little things, but it's actually super complicated. So I am post-call and exhausted, and I have to help my daughter edit her essay. So I hope you guys have a very, very lovely evening. Thank you again for joining us. Thank you very much to the incredible Mary Wong and all the work that she's doing for us in Toronto. Thank you for joining us. And don't forget to join us again next week where we will have another exciting show. We are working on kind of a surprise program coming up soon, hopefully. So I don't know if we'll pull it together by next week. But we're hoping to gather a panel of some kind of internet famous experts and start asking them questions and see what the differences are in their opinions. So we're going to make it almost like a game show and see how people like that. So we hope we'll see you again. Have a great night, guys. Take care.